Good morning, everybody. My name is Mary Malott, and I am the Professional Education Chair for Learn. And by day, I am the Senior Community Engagement Specialist with Molina Healthcare of Idaho. So the content is provided for informational purposes only and is not to be considered legal, financial, or health advice. Please consult with your legal, financial, healthcare, or other service providers before taking action based on information that is shared through Learn. I'm going to introduce Bill Hayab, who was featured as our community spotlight this morning. And Bill is with the Office of Veterans Advocacy, the Idaho Division of Veterans Services. And Bill is a retired Sergeant Major from the United States Marine Corps. And he currently serves as the Bureau Chief and the State Service Officer with the Office of Veterans Advocacy through the Idaho Division of Veterans Services, and he is based out of the Boise VA Regional Office. And before assuming the Bureau Chief position and Service Officer, State Service Officer position, Bill served active duty in the United States Marine Corps for 24 years, and he retired at the rank of Sergeant Major on December the 31st, 2012. I would like to have all of you join me in first off thanking Bill for his incredible service to our country and also his service to fellow veterans, their families, and our community. And he's going to be sharing with us this morning some of the tools, resources, and other services that are available through his office. So a warm welcome to Bill, and thank you in advance for sharing your time and your expertise, and again, your service to our country.
Well, thank you. I appreciate it. And thank you for having me here today. Can everyone hear me okay?
Yes.
I know some of you have heard me speak before, so hopefully this is a good refresher on everything that we do. But again, I work for the Idaho Division of Veterans Services. My boss is Mark Shample, who's the Chief Administrator of the Idaho Division of Veterans Services. And he oversees the operation of the 3 state veterans homes, the one in Boise, the one in Lewiston, Pocatello, and a 4th one being built in Post Falls right now. He has the 2 state veterans cemeteries, the one in Boise and the one in Blackfoot, the state approval agency for the post 9/11 GI Bill for all the education and OJT programs throughout the state of Idaho, and then my office, which are the veteran service officers. I have service officers at the Boise regional office with me. At the Caldwell, we have 3 service officers, 2 in Twin Falls, 2 in Pocatello, 2 in Lewiston, and 2 up in Post Falls. And what we do is we provide a free service to the veterans and family members of veterans in Idaho. And the reason why we exist, the VA is very confusing. Go figure, it's a federal agency. And you don't need to work through us. You can work directly with the VA, but the VA is not going to tell you what the requirement is and guide you through the process. They've got 2 public relations people at the front entrance of the regional office who will hand you a blank form, or you can go to va.gov and pull everything off online. Again, does not really explain what is needed, what's going on, and what's available. So we are trained twice a year by the Veterans of Foreign Wars and accredited with multiple organizations to provide this service free of charge. And the first thing is, a lot of people are confused about the VA. They think it's one big giant organization that's all there to help veterans. While that's true, that's 3 standalone separate organizations that all do something completely different. They do not share information, and you can be treated at the VA Medical Center and the VA Regional Office has no idea you exist. So again, the 3 elements of the VA, where I work in the regional office, falls under VBA, Veteran Benefits Administration. They do all the claims for service-connected disability compensation, non-service-connected pension, which is a means-based program, burial benefits, survivor benefits, VA home loan guarantees, VA life insurance programs, education, vocational rehabilitation and education, and they do the special adaptive housing, special housing adaptation. So that falls under VBA. The VA hospital falls under VHA, Veterans Health Administration. They're there to treat people, take care of their health concerns, and they've got social workers that can help set up in-home care and different things for those veterans that are eligible for it. And then the third leg of the VA is NCA, National Cemetery Administration. And they have all the policies and procedures that govern the cemeteries. Just so everybody's aware, the hospital, or the cemetery in Boise and Blackfoot, those are state veteran cemeteries. They're not VA cemeteries, but they follow all the rules under the National Cemetery Administration. There is a national cemetery in Buell, Idaho. It's the Snake River Cemetery. It falls under the Rural Cemetery Initiative. So again, the only difference between that and the cemetery in Boise, a spouse of a veteran can be interred for free at the Snake River Cemetery in Buell. In Boise, they have to pay the plot allowance fee, which is currently $800 to be interred at the state cemetery. Veterans can be interred for free. Now, what we do at the VA regional office, there's two benefits a veteran can file for: service-connected disability and non-service-connected pension. And there's 5 different ways a veteran can be service-connected through the regional office. A direct service connection requires proof on active duty that a chronic injury, illness, disease, condition happened on active duty that the veteran still has problems with today, and the opinion in the exam process is a current condition is directly related to what happened on active duty. Whether that was a gunshot wound, broken bone, back injury, knee injury, kidney stones, gout, doesn't matter. Did it happen on active duty? Biggest problem with this is there was a fire in 1973 at the National Archives. So if a veteran is doing a first-time claim and they served in the Army, Army Air Corps, Air Force, and separated before 1960, if they served in the Army, or 62 in the Air Force, very good chance all their records were burned up in the fire of 73. So it makes it very difficult to prove a direct service connection when their medical records were all burned up in the fire. But then you have a secondary service connection. So if you get approved service connected for anything and it causes something else to happen, then you get approved on a secondary basis. There's an aggravated service connection. So if they had a pre-existing condition before they joined and that pre-existing condition was made worse beyond natural progression, that can be approved on an aggravated basis. And we have presumptive service connection. For a lot of veterans, this is the only way they can get service connected. So if they were exposed to any form of radiation and they have an active form of cancer, that's presumptive to the radiation exposure. Back in the 50s, when they were doing the atomic testing and putting a lot of veterans on board ship and detonating atomic devices, we've got a lot of veterans that were in that category. If they now have any form of cancer, that can be granted. If they served in Vietnam or boots on ground in Vietnam within 12 nautical miles of the Vietnam coastline, along the perimeters of the air bases in Thailand during Vietnam, on C-123 aircraft all the way through 1986, or along the DMZ in Korea from 68 to 71. And they currently have prostate cancer, type 2 diabetes, coronary artery disease, ischemic heart disease, past heart attack, lung cancer, Parkinson's disease, Parkinson-like symptoms, multiple myeloma, non-Hodgkin's lymphoma, hairy cell leukemia, and they just added bladder cancer and hypothyroidism. That can get approved on a presumptive basis. And for a lot of Vietnam veterans, if it wasn't for the presumptive conditions, they wouldn't be service connected for anything. If they served at Camp Lejeune, North Carolina, my old stomping grounds, between 1953 and 1987, and they have bladder cancer, kidney cancer, liver cancer, multiple myeloma, non-Hodgkin's lymphoma, Parkinson's disease, that's all presumptive to the Camp Lejeune contaminated drinking water. because the dry cleaners were dumping the benzene and dry cleaning solvent straight into the ground, and it went into the drinking water. So as long as they were at Lejeune, New River Air Station, Camp Geiger, Camp Johnson for 30 days or longer and have any of those conditions, that can get approved on a presumptive basis. If they have ALS, Lou Gehrig's disease, any time in their lifetime, that's presumptive to active duty service. Or multiple sclerosis within 7 years of leaving active duty, that's presumptive. Then the last way the VA will service connect is called 1151. So if they're treated at the VA medical center due to negligence or malpractice, they cause a chronic condition, we can get that service connected. And what does service connected mean? Has nothing to do with finances. They can have all the money as Warren Buffett, doesn't matter. A 10% service connection is $144 a month, tax exempt, runs all the way up to $3,200 a month to get rated 100% for a married veteran. And if they have a single 100% rating and they require aid and attendance, help with activities of daily living, for example, if they've got ALS and they're on a ventilator and they need a really high level of care, they can get paid all the way up to $7,000 a month with all the special monthly compensations. The other benefit is called non-service connected pension. And this is what we deal with most of the time when we're dealing with elderly veterans. And it has its own set of rules. The veteran had to have wartime service. So for VA purposes, World War II ended January of 46, and Korea didn't start till June of 1950. So if they served after the end of World War II and before Korea started, they're not eligible for pension. And if they left after 1955 and they left active duty before the Vietnam War began in 1964, they're not eligible for pension. So I had to have at least 1 day of wartime service. They have to be below net worth requirements. So they add up, if it's a married veteran, that's combined assets and combined income. So they add up all assets, what's in checking, savings, stocks, bonds, mutual funds, IRAs. If there's a trust, what's in the schedule of assets of the trust. They can own a home, that does not count against them. But if they own more than one home, or if the property sits on more than 2 acres, we need the fair market value of the land. They have a 36-month look-back period to make sure they didn't gift assets away to anyone. So they add up all the assets. They add up 12 months of income. And again, if they're married, combined income. And then they subtract out 12 months of out-of-pocket, non-refundable medical expenses. And they have to be below $134,000. So if they meet the net worth requirement, the next step is they assign a pension level based on what the veteran's current health is. If the veteran can live on their own and take care of themselves, that's the basic pension rate. If they can live on their own and take care of themselves, but they can't drive, they're indoors all day and need someone to drive them to appointments, that's called the housebound rate. And if they require help with activities of daily living, bathing, dressing, feeding, transferring, that is the aid and attendance rate. By and large, most veterans don't qualify for the aid and attendance rate until they're in assisted living, or they have in-home health care, or they're on hospice care. And they can get approved for this on independent living if they've got something from the doctor saying that their condition is the point they need to be put in a protective environment, and that independent living facility is providing that protective environment. So then they assign a max annual pension rate, and what they do, they add up all your combined income, subtract out-of-pocket medical expenses, and they compare that to the max annual pension rate. So if a single veteran is eligible for the aid and attendance rate and medical expenses are more than their income, the absolute most a single veteran can receive from the VA is $1,950 a month approximately. And a married veteran that qualifies for the aid and attendance rate based on their income, the medical expenses are more than income, they can get $2,200 a month. They still receive whatever income they're receiving, but that's the most they can receive from the VA. Now, if a veteran dies, their monthly award stops. So if they pass away and they're married, if they pass away from a service-connected condition, the VA will pay a one-time payment of $2,000 for a service-connected burial benefit. If they're receiving monetary benefits and pass away from a non-service-connected condition, the VA will pay a one-time payment of $300. If the veteran was not receiving any monetary benefit from the VA and did not pass away in a VA medical facility, the VA does not pay anything. And then the surviving spouse, if there is one, has to qualify for one of the two survivor benefits. One is called DIC, Dependency Indemnity Compensation. That's based on service-connected cause of death. And the other one is survivor's pension, which runs exactly the same way veterans' non-service connected pension would work. The thing to remember is the surviving spouse had to be married to the veteran for 1 year before the veteran passed away, or they're not eligible to receive anything. So it doesn't matter how much a veteran was making. If the veteran dies from a service-connected condition or a presumptive condition that they never claimed, DIC is $1,357.56 a month. If the veteran was rated 100% for 8 years or longer and married to that same spouse the entire time, then there's the enhanced rate of DIC, which pays an additional $277 a month. And if the veteran was rated 100% for 10 years or longer and passes away from anything, could be getting hit by a meteorite, the surviving spouse automatically gets approved for DIC, and they don't have to have the service-connected condition listed on the death certificate. This is important because with the world of COVID, we're seeing a lot of death certificates are coming in saying the veteran passed away from COVID-19 and don't list any other condition as a contributing cause of death. Well, the veteran was rated 100% for coronary artery disease, and the death certificate says COVID-19. That's a showstopper for DIC. So we got to send the spouse back and try to get an amended death certificate to add the coronary artery disease as a contributing cause of death. So that's something to keep in mind. And then the survivor's pension, like I said, works exactly the same way. Veteran had to have wartime service, surviving spouses, net worth has to be below the VA's net worth requirements and all that. The amount of money is a lot less. The absolute most a surviving spouse can receive at the aid and attendance rate if medical expenses are more than income is right around $1,270 a month. So that's how survivor's pension works. We work really closely with health and welfare. So if someone's applying for Medicaid and they're in a Medicaid approved facility and they're on skilled nursing, Medicaid or health and welfare will contact me to verify how much a veteran or surviving spouse is receiving from the VA and how much of that is considered for aid and attendance. So that's not considered as income to speed up the Medicaid packages. And then if they're, again, at a Medicaid approved facility with skilled nursing, we notify the VA and they drop it down to the $90 rate. So the other survivor benefit a surviving spouse may be eligible for is if the veteran is a military retiree and paid into survivor benefit plan through DFAS, Defense Finance and Accounting, then the surviving spouse can receive 55% of the retired pay after the veteran dies. It used to be the federal law said you couldn't have both survivor benefit plan and DIC. That just got changed where you can now receive both. And again, my office can help that surviving spouse apply for the SBP through Defense Finance and Accounting. So I think I just hit my 15-minute mark. And if anyone has any questions, we're here to help.